Have you ever found yourself in a doctor's office just nodding along, pretending you understand every single complex medical term they throw at you
Right.
while, secretly wishing you had some kind of built-in translator right there?
Definitely. Or maybe you've struggled to describe exactly how you're feeling, searching for just the right words for a symptom.
Yeah, and you end up feeling a bit overwhelmed, right, by all the jargon, the specialized vocabulary in healthcare, that feeling of information overload, where you just want a clear path to being well-informed without all the confusing stuff.
Exactly.
Well, that's precisely why we're here today on The Deep Dive.
Yeah.
Our mission today, to really take a comprehensive look, a deep dive into the language of medicine. We want to help transform you, our listener, into a more confident, truly informed participant in your own healthcare journey.
That sounds great.
We're going to unpack some surprising facts, share practical insights, and hopefully unlock those aha moments, where complex medical ideas suddenly just click.
It's really remarkable, isn't it, how vital clear communication is, especially, when it comes to our health.
Absolutely.
And it's not just about figuring out what your doctor is telling you. It's also about empowering you to talk about your own experiences accurately.
Right.
Effectively.
Giving you the tools.
Precisely. So today, we're going to distill the most important nuggets from the source material you shared. We'll equip you with essential medical expressions.
Okay.
We'll cover everything from understanding the nuances between different patient types, the roles of various medical professionals,
Right.
to really mastering the precise language you need for describing symptoms and understanding treatment plans.
So it's not just learning definitions then?
No, not at all. This is about gaining truly practical, real-world knowledge, stuff you can actually apply immediately, in any medical setting. It's about helping you navigate the whole healthcare system with hopefully significantly greater ease and confidence.
Yeah, it's like pulling back the curtain on those phrases and terms that can feel like a completely foreign language, right? And turning them into practical tools you can actually use. So to really build a solid foundation for this, let's start at the very beginning of any medical interaction. Understanding who exactly a patient is. It might sound obvious, but there's a really crucial distinction here that I think a lot of people miss.
Yeah, I think you're right.
I mean, many of us probably assume that if we just have a doctor, maybe on speed dial, or if we see them for an annual checkup, we're just automatically always considered a patient.
Right.
But the source material, it makes a really clear distinction. Might surprise some people.
Yeah, that is a common misconception, and it really highlights an important point about how the medical system, formally views people. The core definition from our source is quite precise.
Okay.
A patient is specifically defined as a person who is receiving medical care.
Receiving.
Yes. It implies an active kind of ongoing engagement with the healthcare system for diagnosis, treatment, maybe management of a health condition. So if you're like me, maybe you have a family doctor, but you haven't actually had a specific medical consultation or treatment in, quite some time. You aren't currently a patient in that strict sense.
Right. You're just a person with a doctor.
Exactly. Yeah, just a person with a doctor on file, maybe.
That's a really clear distinction then. So if you're just someone who has a doctor, you might see for an annual checkup that's, months away. Or maybe you haven't needed to see them for years. You're not technically a patient until you actively seek or receive care.
Precisely. The source gives a perfect, really concrete example. It says, right now I'm not a patient, even though I have a doctor. I'm not a patient because currently I'm not receiving medical care.
Wow. Okay.
And this definition, it isn't just about words, It can actually impact things like your insurance coverage, maybe how hospital resources get allocated, even your legal rights during care. Certain privacy rules, service protocols, they might apply differently depending on whether you're formally an active patient right now.
Right.
Versus just, having a doctor on file for maybe future needs.
Yeah.
It clarifies your current status within the system's engagement.
Okay, that makes a lot of sense. So with that clarified, let's look at the two main ways you might actually experience being a patient. And it seems like it really just boils down to one simple question. Are you staying overnight?
Indeed. Yeah, that's the crux of it. The medical world categorizes patients primarily into two distinct types based on, length of stay and the intensity of care needed. inpatient and outpatient.
So the big difference really is just whether you spend the night in a hospital, right? It seems very tangible, almost like black and white.
It absolutely is, yeah. An inpatient is defined as a patient who is admitted to the hospital to receive care.
Admitted, right?
Yeah. This means they physically stay overnight. Could be just one night, maybe a week, sometimes even longer. They occupy a hospital room, a hospital bed.
Right.
This category implies a higher kind of continuous level of monitoring. It's typically for more severe or complex conditions that really need prolonged medical attention.
Okay.
So, for example, if you have major surgery and you need a recovery period with constant medical observation, or you're dealing with a really serious illness needing round-the-clock specialized care, you'd be an inpatient.
So if you're an inpatient, you're basically like living at the hospital for that time, getting continuous care observation in your own room.
That's a good way to picture it, yeah. And then in stark contrast, you have an outpatient.
Okay.
An outpatient is a patient who receives care without being admitted to the hospital. The key, as you said, is they do not stay overnight.
Right.
And interestingly, our source notes that most people usually fall into this category for, the majority of their medical interactions.
Okay. Like a regular doctor's visit.
Exactly. Or a classic example is when you go to the ER, the emergency room, for a sudden injury, maybe a broken arm.
Mm-hmm.
They treat you for that specific urgent issue, and then you leave same day.
Right. You don't stay.
You don't stay overnight. This type of outpatient care, it addresses things that are episodic or less acute needs, or maybe diagnostic procedures that just don't require an extended hospital stay.
So even a visit to the emergency room counts as outpatient usually, as long as you go home afterwards.
Yes. It's really fascinating how this seemingly simple distinction, staying overnight versus going home, dictates the entire care pathway, from how resources are allocated in the hospital to the specific intensity of medical supervision you get. This categorization really clearly defines the level of medical need and the scope of resources dedicated to your care.
Right.
It even subtly influences how you communicate your needs and, understand your treatment environment.
And speaking of the ER, you mentioned that these different patient types, inpatients and outpatients, they often find themselves in very specific specialized areas within the hospital system. And that depends entirely on how severe and urgent their condition is, right?
Yes, exactly. Two of the most commonly recognized and frankly critical departments within any hospital are the ICU and the ER. And they each serve very distinct purposes.
Okay, so the ICU, that sounds like it's clearly for the most critical, maybe life-threatening situations. While the ER is more about that immediate, urgent attention for, like, acute problems. They sound like they have fundamentally different functions, different levels of care.
That's a really excellent summary. Spot on. The ICU, which stands for the Intensive Care Unit,
right,
is a highly specialized area within the hospital. This is where inpatients go to receive the absolute highest level of critical care.
Okay. Highest level.
Yeah. This unit is specifically designed, it's equipped with advanced technology, staffed by highly specialized nurses and doctors, all to provide constant, really minute-by-minute supervision for patients with life-threatening conditions, severe injuries, or maybe organ failure.
What?
Think of it as like the ultimate level of medical intervention, where medically fragile patients are monitored 247 with the focus entirely on stabilizing and supporting their vital bodily functions.
So if you hear someone's in the ICU, you immediately understand the gravity, the seriousness of their situation. It means very serious, continuous care.
Exactly, yeah. Then we have the ER, or emergency room.
Okay.
This is the place outpatients typically visit first. They go there to receive immediate care for a specific urgent medical treatment or illness before being discharged.
Right. So you go in, get treated, and usually leave.
Usually leave, yeah. It's the main entry point for those acute medical needs that just cannot wait for a regular doctor's appointment. Things like a suspected heart attack, a broken bone, maybe a severe allergic reaction, or a sudden, really debilitating illness.
Okay.
The main goal in the ER is to rapidly stabilize the patient, provide a quick diagnosis if possible, and offer immediate treatment.
And then what happens?
Well, from there, the patient is either discharged, sent home, or if their condition warrants it, they get admitted to the hospital as an inpatient.
Oh, okay.
And they could potentially even move from the ER to the ICU if it's that serious.
Got it.
Just knowing these crucial abbreviations, ICU, ER, and understanding their functions, it can significantly reduce anxiety, I think. And it helps you understand the seriousness and the specific type of care being given in different parts of a hospital.
Yeah. Definitely helpful context. Okay, so now that we've got a better handle on patient types and the different environments within a hospital, let's shift focus. Let's talk about the people actually providing that care. Who's who in healthcare? Because it can feel like a vast, sometimes confusing landscape of medical professionals, right?
Yeah.
And understanding their role seems vital for communicating effectively.
Absolutely critical, yeah.
We all know the terms doctor and nurse, of course, but even within those broad categories, there's like a significant amount of specialization, different levels of expertise.
That's right.
The GP, or general practitioner, that's often our first stop, right? Handling a whole range of issues. And then we have the incredibly vital nurses, each with distinct training and responsibilities. It's not just one type of nurse.
You're absolutely right. The terms doctor and physician, they're the most common and largely interchangeable terms for medical professionals. Though doctor is probably a bit more common in North America day to day.
Okay.
Now, the GP, the general practitioner, they really are the cornerstone of primary care. This is a doctor who has a broad medical knowledge base.
Right.
That allows them to treat a really wide array of general health concerns.
Right.
They act as your primary point of contact for all sorts of diverse health issues. Essentially, yeah, your first stop for most medical needs.
So you could go see your GP because, I don't know, you have a persistent back pain.
Yep.
Or maybe just a common cold, a throat infection, even a minor eye issue. They handle a lot.
Precisely. They handle a huge range. They provide broad diagnostic capabilities. They start treatment plans, manage ongoing chronic conditions like diabetes or high blood pressure. And importantly, they act as a guide to more specialized care when it's needed.
Okay.
Then we have nurses. And as our source rightly emphasizes, they are considered just as indispensable as doctors.
Absolutely.
Their roles are incredibly diverse, really critical. It covers everything from providing direct patient care, administering medications, educating patients about their health conditions, to assisting doctors in complex procedures. They do so much.
And there are different kinds of nurses, right? With different levels.
Yes, exactly. Within the nursing profession, you encounter different levels of training and responsibility. Each one is vital to the healthcare ecosystem. A registered nurse, or RN,
Okay.
is someone who has a nursing degree and a license in their specific area of practice. They really form the backbone of hospitals, clinics, all sorts of healthcare settings. They provide comprehensive, compassionate nursing care across a huge spectrum of patient needs.
And then there's the nurse practitioner, the NP. You mentioned earlier they sound like they have a bit more autonomy.
They do, yeah. And their role is becoming increasingly significant in modern healthcare. A nurse practitioner, or NP, has acquired more advanced training beyond an RN, often a master's degree, sometimes even a doctoral degree.
Wow.
And this advanced training allows them to diagnose and treat specific medical conditions independently.
Independently, so they can diagnose.
Yes. And in many places, they're also authorized to prescribe medications.
Okay.
Their expanded scope of practice means they can often serve as a patient's primary care provider, handling everything from common illnesses and routine checkups to managing chronic diseases.
Interesting.
You know, the collaborative synergy between GPs and these various levels of nurses, RNs, NPs, it really forms the essential backbone of daily medical care. It ensures comprehensive, accessible, and continuous support for patients across all settings. They are truly foundational to how healthcare actually gets delivered day to day.
So beyond these really essential generalists, the GP and the nurses, the medical world is just packed with highly specialized experts, right? Each one dedicated to a really unique area of focus. It's quite fascinating when you think about the depth of expertise available.
It truly is. The level of specialization in medicine is, well, it's astonishing, and it allows for incredibly targeted and effective care, especially for complex or organ-specific health issues where, you know, a generalist scope might not be enough.
Right.
So let's dive into some of the most common and vital specialists you might encounter, drawing from our source material.
Yeah, this next bit is crucial, I think. Just knowing who does what can save you so much time and maybe worry. The variety is incredible.
Okay, first up, the surgeon. Pretty straightforward. A doctor whose primary role is performing surgery.
Right, operating.
Exactly. These are the medical professionals who literally operate on the body to repair injuries, remove diseased tissues, maybe correct deformities.
Okay.
Then we have the cardiologist. They specialize in conditions related to your heart.
Heart doctor. Got it.
Yep. From diagnosing heart disease to managing complex cardiovascular issues like arrhythmias or heart failure. If you have issues with your skin, hair, or nails, you'd see a dermatologist.
Skin specialists.
Exactly. They focus specifically on those areas, treating everything from acne and eczema to more serious things like skin cancers.
Okay. And for kids, there's a specific doctor just for them, isn't there?
Absolutely.
Okay.
A pediatrician. This is a doctor who specializes exclusively in the care of children, right from infancy through adolescence.
Okay.
They handle everything from routine well-child checkups and vaccinations to diagnosing and treating all sorts of childhood illnesses. And our source even includes that delightful cultural note for North America.
Oh, yeah, the lollipop.
The lollipop, exactly. Pediatricians often offer children a sucker, which is just a lollipop or some small treat after the visit. Apparently, it's a common practice because, well, kids are often scared of going to the doctor.
Yeah.
So it's just a little gesture to make the experience less intimidating, maybe a bit more positive for them.
That's a great little detail. It really humanizes it for kids, doesn't it? It makes a potentially scary visit a bit better. What about help with our eyesight and our teeth?
Right. For eye care, especially if you wear glasses or contact lenses, you'd frequently visit an optometrist.
Optometrist, okay.
They specialize in doing comprehensive eye exams, diagnosing vision problems, and prescribing corrective lenses or maybe vision therapy. And for your oral health, keeping your teeth and gums healthy, you'd see a dentist. They focus on preventing, diagnosing, and treating oral diseases.
Okay. And then there's that one acronym. Everyone seems to use it, but almost nobody knows what it actually stands for.
Ah, yes, the classic OBGYN.
Right.
This is a doctor specifically for women, dealing comprehensively with pregnancy, childbirth, and all sorts of reproductive health issues. And as our source hilariously notes, I have no idea what this stands for, which perfectly captures how common that feeling is, because the acronym is just so pervasive, everyone uses it, that the full form is hardly ever spoken or even thought about. But just for the record, it stands for obstetrician gynecologist.
Ah, okay. Good to know.
But practically, yeah, everyone just says OBGYN.
That's a really crucial one to know, especially for women navigating their health. What about the person responsible for, well, putting you to sleep safely before surgery?
That would be the anesthesiologist.
Right. That's a long one.
It is. They are highly specialized doctors who administer anesthesia. That's the medication that makes you unconscious or maybe numbs a specific part of your body before surgery. And they meticulously monitor your vital signs through the entire procedure, making sure you're stable and safe. And yeah, this is definitely one word that, as the source points out, even native English speakers often have trouble pronouncing, anesthesiologist.
Yeah, it's a mouthful.
It is a mouthful, but their role is absolutely critical for patient safety during any kind of surgery.
Okay. And after surgery, or maybe for diagnosing internal problems, you might see a radiologist.
Yes, a radiologist. They are the medical experts responsible for conducting and, crucially, interpreting various imaging tests. Things like X-rays, CT scans, that's computed tomography and MRIs, magnetic resonance imaging.
So they read the scans.
Exactly. They provide essential diagnostic information by basically seeing inside the body. They translate those complex images into clear findings for the other doctors involved in your care.
So they're like the eyes inside the body telling the rest of the team what's going on.
Precisely. Yeah, that's a good way to put it. And, in today's world, with a more comprehensive approach to health, mental well-being is seen as just as important as physical health.
Absolutely.
And for that, we have the psychiatrist. They focus specifically on mental disorders and conditions affecting the mind. They often prescribe medication or might recommend therapy.
Okay.
Our source even shared that relatable anecdote here. Their neighbors happen to be a GP and a psychiatrist.
Oh, wow.
Which kind of highlights the importance of that integrated care, right? Addressing both physical and mental needs together.
That's pretty convenient for them. Comprehensive care right next door. And finally, there's a specialist who tackles a very specific but interconnected trio of body parts.
Yes, the ENT. That acronym stands for ear, nose, and throat.
ENT. Got it.
Yep. An ENT specialist, formerly they're called an otolaryngologist, but nobody says that.
Right.
Focuses specifically on conditions affecting these three interconnected areas. They treat everything from chronic hearing loss and recurring sinus infections to throat problems like tonsillitis.
Okay.
The really profound insight here is how each specialist represents this concentrated body of knowledge and expertise. It allows for highly targeted, really effective care when general treatment just isn't enough.
Yeah.
And understanding these different roles, it empowers you not only to comprehend your care plan better, but also to actively advocate for your own health.
Right.
Knowing when a general issue might need a deeper, specialized look.
Right.
And knowing who to ask your GP for a referral to. This knowledge can genuinely help you navigate that often complex referral system much more effectively.
Definitely. Okay, so now that we've got a clearer picture of who you might see, let's move on to the actual interaction itself. What happens when you have a medical consultation? Whether it's just a routine checkup or maybe an urgent visit that leads to a full diagnosis.
Right. The consultation itself.
A routine checkup, that's something we all know we should do, right? Ideally, maybe every 6 months or once a year, where you see your GP just to review your overall health, even if you don't have a specific pressing issue. But beyond just, checking in, what exactly are doctors looking for when they take those vital signs? It feels so basic, but why are they called vital?
Yeah, the routine checkup is really fundamental for proactive, preventative healthcare. You go in without a specific complaint just to make sure everything's okay and establish a kind of a baseline for your health right now.
Okay.
And during this appointment, your GP will absolutely examine your vital signs. And they're called vital precisely because they are key physiological measurements that give a crucial immediate snapshot of your body's most essential functions.
So what are they typically?
They include your temperature, your heart rate, that's how fast your heart is beating, and your blood pressure, which is the force of your blood pushing against your artery walls.
Okay, so temperature, heart rate, blood pressure. Those are the big three vital signs that give that quick health overview.
Exactly. And what's truly insightful here is how these seemingly simple measurements, they are the immediate objective indicators of your body's most essential operations. They're not just random numbers. They're quick snapshots that can rapidly signal underlying issues, or they can confirm good health. They really guide the doctor's initial assessment and might prompt them to look deeper.
Right, like an early warning system.
Precisely. For instance, if you have a consistently high blood pressure reading, even just during a routine checkup, that could be an early warning sign. It might prompt your doctor to recommend immediate lifestyle changes or maybe even prescribe medication to prevent more serious heart problems later on. Now, even during a routine checkup, if some specific medical concern or maybe an anomaly pops up, your GP might decide to refer you to a specialist.
Okay, a referral.
Yeah. And this isn't just a casual suggestion. It means they are formally sending you to another doctor who has more focused, in-depth expertise in a particular area.
Right.
So, for example, if you mention persistent ear problems during your checkup, your GP might say, okay, I'm going to refer you to an ENT. It's their way of making sure you get the most appropriate, targeted expert care for your specific needs. They really act as your trusted guide within the complex medical system.
So the GP acts as a crucial coordinator then, almost like a gatekeeper for navigating that more specialized care, making sure you don't just wander into the wrong expert's office by mistake.
Precisely.
Yeah,
they often orchestrate your overall health management and make sure you connect with the right person at the right time for those more complex issues.
Okay. Sometimes, though, you're not there for a routine checkup at all. You're there because something feels clearly wrong. You have a specific pressing complaint, and that's that critical moment when you have to start describing your symptoms.
Yes, this is arguably the most critical moment in any medical consultation.
Yeah.
A doctor's very first question, often before anything else, is typically, what are your symptoms?
Right. And this next point is so crucial, being able to articulate what's happening in your body accurately. That is absolutely key for getting a diagnosis. And it all starts with that classic question, what are your symptoms? A symptom, as defined in the source, is basically any feeling of illness, discomfort, or change in your body that you're currently experiencing or maybe have had in the past that you want to discuss with your doctor or specialist.
Yeah.
It's your subjective experience of illness, isn't it? And your description guides everything that follows.
Absolutely. Your ability to clearly, concisely describe your symptoms is just paramount to getting an accurate diagnosis and effective care. It's really about translating your very personal physical experience into language the medical professional can understand and act on.
Right.
For instance, instead of just vaguely saying, I hurt somewhere, being specific makes all the difference in helping them narrow down the possibilities.
Yeah.
Our source gives some really excellent practical examples of how to articulate what's wrong with precision.
Okay, let's hear them.
For general suffering or pain, you could just say, I have a lot of back pain. Pretty straightforward. But to convey a higher level of intensity, you could use the verb suffer. Like, I'm suffering from severe back pain.
Severe.
Yeah, the word severe here isn't just an intensifier. It implies a really high intensity, often rated as an 8, 9, or even a 10 on that common pain scale of 1 to 10.
Okay, so it gives a clear measure.
Exactly. Another common localized complaint might be, my left arm is sore. That clearly pinpoints the location and the type of discomfort. Super helpful for a doctor.
Right.
Or, describing a sensory issue, my feet are numb, which specifically means you can't feel your feet. That immediately signals a loss of sensation, guiding the doctor towards maybe neurological causes. If your sight is affected, you'd say, my vision is blurry, meaning you can't see very well, or objects look unclear, kind of like a low-resolution photo or video.
Okay, good analogy.
Yeah, it gives the optometrist or ophthalmologist a clear starting point, and a feeling many have experienced, maybe in a rocky boat or a roller coaster. I feel nauseous.
Ugh, yeah.
Our source describes this perfectly as the feeling you get when you're on a roller coaster, which instantly paints a vivid picture for the doctor.
Those mini definitions really do help clarify the exact meaning of each symptom, don't they? It's not just the word, but the specific experience it conveys, giving the doctor invaluable clues.
Exactly. And this level of precise vocabulary is so critical, because it means you're not just reporting some general discomfort, you're actively participating in your own diagnosis and care. You're making the doctor's job significantly easier, which leads to more effective treatment. These detailed descriptions can often really narrow down the diagnostic possibilities for the doctor, even before they do a physical exam or order any tests.
Okay, so once symptoms are thoroughly discussed and the doctor has that clear verbal picture, they often need objective evidence, right, to confirm or rule things out. And that leads directly to diagnostic tests.
Right. After listening really carefully to your symptoms, and often doing a preliminary physical exam, the doctor will likely recommend certain diagnostic tests.
So after you've bravely shared all your symptoms, the doctor needs to dig a bit deeper with these tests. What does that process involve? And how do they actually help confirm a diagnosis?
Well, diagnostic tests are specific tests or exams performed precisely to determine the existence or absence of a particular medical condition, disease, or illness. These tests essentially bridge the gap from your subjective reports, what you feel and describe, to objective, verifiable evidence.
Ah, okay. Objective evidence.
Yeah. Common examples you've probably heard of include an MRI, that's magnetic resonance imaging, an X-ray, or a CT scan, a computer tomography scan. What's really insightful here is how these advanced technologies let doctors literally see inside the body in incredible detail. They complement the patient's story with crucial physiological or structural data that can confirm or rule out specific conditions.
So these tests are about getting a clearer, undeniable, more objective picture of what's going on inside, beyond what you can describe or what they can just see on the surface.
Precisely, yeah. And after these diagnostic tests are done and the results are carefully reviewed, the doctor arrives at a diagnosis.
The diagnosis, okay.
This is the final judgment or conclusion about what the illness or medical problem actually is. It's the definitive identification of your health issue, like a medical label for what's happening in your body. It's typically made after considering everything: your symptoms, your complete medical history, and the objective results from any diagnostic tests.
Right, putting all the pieces together.
Exactly. Zooming out, this is kind of the scientific validation step in understanding your specific health issue, and it leads directly to a definitive, targeted plan for your care.
And once that diagnosis is finally made, the conversation naturally shifts towards the path forward, the treatment.
Yes. What do we do about it?
Exactly. So once a clear diagnosis is reached, the focus immediately shifts to the treatment options. And well, often a big part of that path involves a prescription, right?
Yeah.
What exactly is that document, and why is it so vital in the whole healthcare process?
Right. Once a diagnosis is confidently made, the doctor will thoroughly discuss the available treatment options. These are simply the various courses of action that can be taken to address your specific medical issue or the different types of treatments available.
Okay.
And this is a critical kind of deliberative process. The doctor carefully considers the most effective and appropriate approach based on your unique condition, how severe it is, your overall health, and any potential interactions or reasons why a certain treatment might not be suitable for you. Now, if a chosen treatment option involves medication, then the doctor will write you a prescription.
Right. Write you a prescription.
Yeah. And a prescription is more than just a piece of paper or an electronic file now. It's a formal, legally binding, written, or yes, increasingly electronic order from a doctor for a specific medical treatment, like a particular drug or pill. What's really insightful here is how the prescription acts as this crucial, direct bridge. It seamlessly translates the doctor's expert judgment and their carefully crafted treatment plan into a tangible, specific instruction for both you, the patient, and the pharmacist.
Ah, okay.
It ensures you get the exact medication, at the correct strength and quantity. And that significantly minimizes the risk of errors and ensures consistent, effective care.
So even if they're just typing it into a computer and sending it electronically, that phrase, write you a prescription, still sticks because it signifies that official directive.
Exactly. It's the formalized authorization that ensures you get the precise medicine from the pharmacy. And it carries the full weight of the doctor's medical expertise and responsibility.
Got it. And once you have that prescription, your very next stop is almost certainly the pharmacy, where another vital healthcare professional steps in and they play a much more active role than just handing out pills, right?
That's absolutely right. You take your prescription to a pharmacy, which is the designated place where you get your prescribed medications. And at the pharmacy, you'll interact with a pharmacist. They are highly trained and, frankly, indispensable medical professionals.
Yeah, let's really appreciate this point. The pharmacist isn't just a dispenser. They're absolutely critical to the safety and effectiveness of your treatment plan.
They truly are an indispensable part of your healthcare team. They act as a vital checkpoint. The pharmacist fills the prescription, which means they accurately provide you with the specific medical treatment indicated on that prescription. But their role goes way beyond just handing over the medication. The prescription also contains critical information about the dosage. Yeah, that specifies the precise amount or quantity of the medical treatment. For instance, it dictates how much of the active drug you're getting, or the exact quantity of the active ingredient within each pill. The pharmacist relies on this crucial detail to make sure you receive the correct and safe amount of medication.
Right. Getting the dose right is crucial.
Absolutely. And what's really fascinating here is that pharmacists aren't just fulfilling an order. They are meticulously ensuring patient safety. They explain the how and, crucially, the what if of your medication. They also play a pivotal role in discussing side effects. These are the unintended consequences or adverse reactions that can sometimes happen as a result of a specific medical treatment.
Like if a pill for your arm gives you a headache.
Exactly that. If you take a pill prescribed to help a sore arm, but it unexpectedly causes headaches, that headache is a side effect.
Got it.
The pharmacist's meticulous attention to dosage and their comprehensive discussion of potential side effects are crucial, both for the effectiveness of the treatment and for your overall well-being. They make sure you understand what to expect and what to watch out for.
So the pharmacist really serves as that last critical line of defense, making absolutely sure you understand how to take your medication safely and effectively.
Absolutely. They're essential navigators in your medical journey.
Okay. So with the treatment plan now initiated, the medical journey often includes checking back in to see how things are progressing, right? That's where the follow-up appointment comes in.
Precisely. Yeah. Once you've started a treatment, it's rarely just a one-and-done situation. Effective medical care is often an iterative process, a back and forth.
So the follow-up appointment is really all about course correction then, making sure that the treatment is genuinely doing what it's supposed to do for you.
That's an excellent way to describe it, yeah. A follow-up appointment is specifically scheduled with your GP or specialist to meticulously discuss the effectiveness of the treatment plan you've been following.
Okay.
This is where that iterative, kind of dynamic nature of modern medical care becomes really clear. During this appointment, you'll have a thorough discussion about, well, have your symptoms been relieved at all? Is the current course of action, the treatment, actually working? Or maybe is there a need for any adjustments, maybe to the dosage, or perhaps even a completely different prescription altogether?
Right. Fine-tuning the plan.
Exactly. And this brings up a critical point.
Yeah.
The follow-up ensures that the treatment stays optimized specifically for your individual response and your evolving condition. It's not just a review. It's really an ongoing partnership between you and your healthcare provider to achieve the absolute best health outcome. It allows the doctor to fine-tune the plan based on your real-time progress and any new developments or maybe challenges you might be experiencing.
Okay. And speaking of prescriptions, it's definitely worth noting that not all medications require one, right? There's a pretty significant distinction between what your doctor needs to formally write out for you and what you can sometimes just pick up yourself.
Indeed. Yeah, this brings us to a crucial difference in how medications are legally accessed and regulated. It's quite important.
Right. This next point is quite insightful. Not all medications are created equal, and some you can literally pick up along with your groceries. That's what we call over-the-counter medication, right?
Yes, that's correct. Over-the-counter, or OTC, medication refers to any medication that can be obtained without a formal prescription from a doctor.
No prescription needed.
Nope. These typically contain limited active medical ingredients and are generally of a lower strength, meaning they're considered safe enough for self-medication for minor ailments as long as you use them as directed.
Okay.
And in North America, you can often buy these at a dedicated pharmacy counter, or you can even find them readily available on the shelves in a regular grocery store.
So just like the source points out, you can get this over the counter, which literally means you can just go to the pharmacy or, even a grocery store in North America and just buy it right alongside your eggs, bread, your milk.
Exactly. Yeah, no special permission needed. And this stands in stark contrast to those medications for which a doctor must write you a prescription. Those indicate they are not available OTC.
Right.
These prescription medications are generally stronger, they might carry a greater potential for significant side effects, or they require a professional diagnosis to ensure they're used appropriately and safely.
Makes sense.
What's truly fascinating here is the meticulously designed system of regulated access to medications. It's fundamentally structured to protect public health and ensure appropriate use. It really reflects a careful, deliberate balance between making things accessible for patients and ensuring overall safety. Governmental or regulatory bodies rigorously decide what falls into each category based on risk and necessity.
Okay. Now that we've kind of navigated the entire medical journey from that initial diagnosis all the way through to treatment,
Right.
let's switch gears. Let's get really practical. Let's talk about the exact phrases you'll need to use to communicate effectively and confidently at your very next medical visit, starting right from the moment you walk through the door.
Okay, the practical stuff. Let's do it.
Let's dive into that moment you first walk into a doctor's office. You need to tell the reception desk why you're there. The standard phrase seems simple enough. I have an appointment at 3 p.m. with Dr. Sharma. But you're saying it actually carries a lot of precise meaning in a medical setting.
Yes, this phrase is indeed very specific, and its precision is vital for clear communication in a healthcare context. The crucial distinction here, as highlighted in our source material, is that in a medical context, you always use the word appointment.
Appointment, got it.
Always appointment. Never meeting.
Why not meeting?
Well, if you were to say, I have a meeting at 3 p.m. with Dr. Sharma, it would immediately sound to the staff like you're there for a business purpose. Maybe to sell medical equipment or discuss facility expansion or some administrative thing, not as a patient seeking medical treatment. Using appointment immediately signals your status as a patient there for care. And that's critical for the front desk staff to understand your purpose efficiently and direct you properly.
So that one word choice fundamentally changes the entire perceived purpose of your visit in the minds of the staff?
Wow. Absolutely. Yeah. The correct verb to use is have, as in, I have an appointment. And grammatically, there's some flexibility in the word order. I have an appointment with Dr. Sharma at 3 p.m. is also perfectly correct and very commonly used.
Okay.
Our source also gives us some interesting pronunciation notes that help you sound more natural. An appointment often links together, so it sounds more like an appointment.
An appointment. Okay.
Yeah, the an flows right into appointment. Also, the T sound at the end of appointment is often softened or sometimes even silent when it's immediately followed by at. So appointment at kind of merges together more naturally in spoken English. Appointment at.
Appointment at, right. So it's not just about picking the records, but also how they kind of flow together, creating a more natural, clear communication. That appointment at flow is definitely something worth practicing.
It definitely helps with natural flow and immediate comprehension, yeah. And it's interesting, while appointment is critical in a medical context, it's also used for other prearranged services, right? Like getting your hair done, nails done, getting a massage. But in healthcare, its meaning is especially narrowed to patient care. It really emphasizes you are there specifically for medical attention.
Okay. You've successfully checked in. You've stated your purpose using the right word. Now it's time to wait. And you'll almost certainly hear this next very common phrase.
Yes. After you've confirmed your arrival and stated your purpose, the most common phrase a patient hears from the receptionist is probably, please have a seat in the waiting room.
Ah, yes. This next point is quite insightful. It's the quintessential phrase, isn't it? The one you hear right after checking in at almost any medical office. It seems so straightforward, but you're saying there are subtle politeness cues and even pronunciation nuances baked into it.
It truly is a universal instruction in pretty much any medical setting. This phrase is typically said by the receptionist or maybe other administrative staff. Grammatically, it's an imperative sentence, basically, a command or instruction.
Right. Have a seat.
Exactly. But critically, adding please, either at the beginning, please have a seat, or sometimes at the end, have a seat in the waiting room, please, softens that instruction significantly, makes it sound much friendlier, more polite.
Mm.
The waiting room itself, well, it's simply defined as the room where you wait for the doctor. And it's often the place where you might find yourself thinking, as our source amusingly points out, where is the doctor? My appointment was 20 minutes ago.
Yeah, we've all been there.
We have. Our source also highlights a useful pronunciation tip here, too. Havara often links together naturally to sound like hava.
Have a seat.
Exactly. So you'd hear, please have a seat in the waiting room. This seemingly simple phrase, it's really about clearly setting the expectation that you'll need to wait and courteously guiding you to the designated area. And that deliberate choice to add please, it reflects a deeply ingrained practice in English to soften commands. It fosters a more pleasant, more reassuring interaction, even in a potentially stressful or anxious environment, like a medical waiting room.
Okay. And then after you've waited maybe longer than you'd hoped, the moment you've been anticipating finally arrives, the doctor is ready to see you. But how the staff phrases that, you're saying that can actually tell you a lot about how long you'll really be waiting.
Yes. This is where those subtle time expressions become incredibly critical for managing your expectations. The most common phrase indicating the doctor's readiness is usually, the doctor will see you shortly.
Okay, shortly. Well, let's break this down. The receptionist might use different time expressions, right, to tell you the doctor is coming. And these actually carry very distinct meanings about how long you're likely to wait. It's far from just a casual choice of words.
It's quite fascinating, isn't it, how nuanced English can be in these everyday administrative phrases. Now, when they use the doctor, it typically implies it's your specific doctor, the one you're scheduled to see.
Right.
If the receptionist uses a specific name, like Dr. Sharma will see you shortly, then you wouldn't use the, because Dr. Sharma is a proper noun.
Got it.
However, if they say a doctor will see you shortly, that indicates that any available doctor will attend to you. Maybe to speed things up if you're in, say, an urgent care setting and not assigned a specific physician for that visit.
Okay.
Now, let's really dig into those key time expressions and their subtle but highly distinct meanings. These are absolutely crucial for setting your expectations.
Okay, lay them on us.
First, in no time. This communicates that something will happen very quickly, almost instantaneously. If the receptionist says this, you should expect the doctor to be ready for you almost immediately, maybe within seconds or a minute.
Wow, okay, that's the dream.
That's the dream, yeah. Second, shortly or soon. These indicate an average amount of waiting. It means a short period, perhaps a few minutes, but definitely not as immediate as in no time. And remember, our source explicitly states that soonly is not a word in English, so always use soon or shortly.
Right, no, soonly. Got it.
No, soonly. And third, in a while. This phrase suggests it will be a long time, or that the doctor is significantly delayed. If you unfortunately hear this, it's a pretty clear signal that, as the source says, you might as well start working on something else, because you're likely going to be there for a substantial period.
Oof. Okay, so in no time is fantastic news, shortly is typical and manageable, and in a while means prepare for a significant wait. Maybe grab a book or catch up on emails.
Precisely. That's the code. What's truly insightful here is how these seemingly interchangeable phrases actually communicate vastly different implied time frames. Understanding these subtle cues can genuinely help you manage your time and your patience, effectively turning potential frustration into, well, informed, managed waiting.
Definitely useful. Now, before you even get to the diagnosis, or really at any point in your interaction, there is a core conceptual difference in how medical services view you compared to other services you might receive out in the consumer world.
Yes, this is a really important linguistic and conceptual distinction in the healthcare landscape, and it often trips people up, I find.
Right. This next point is quite insightful and maybe surprising. Even if you're paying for healthcare, you're emphatically not a customer. Why is that? And what term should you always use instead?
Our source explicitly states, and it's worth emphasizing, in a medical sense, you should never use the terminology of customer.
Isn't there
Customer.
Oh.
Never. The term customer is used almost exclusively in a business context. It inherently represents a buyer-seller transactional relationship. Now, while it's undeniably true that in most countries patients do pay for medical treatment, making it in a purely transactional sense, a buyer-seller situation, the appropriate and universally accepted terminology in a medical context is always patient.
Always patient.
Always patient. What's truly fascinating here is how the specific language we use fundamentally frames the entire relationship in healthcare. Using patient elevates the interaction far beyond mere commerce.
How so?
Well, it inherently emphasizes things like care, vulnerability, trust, and the unique, profound responsibility of the medical professional towards the individual. For instance, when you interact with staff at a dentist's office, an optometrist's office, any doctor's clinic, they will consistently refer to you as a patient.
So if you call to make an appointment, they might even ask, are you a patient here? They'll use that exact term.
Exactly. That highlights the critical point. Why is this distinction so important?
Yeah.
Because it reinforces the fundamental idea that healthcare is, well, a fundamental human need, maybe even a right in many societies, and not merely a commodity to be bought and sold like a TV or something.
Right. It's different.
It distinguishes a healing relationship built on trust and expertise from a purely commercial one. Our source also makes a good point about the term client. While client is used in other non-medical service contexts like consulting or hairdressing and often implies maybe more intimate, ongoing relationship than customer, in healthcare, patient remains the correct and universally used term. It maintains that specific, important gravity of the medical interaction.
So for your hair, you're a customer or maybe a client, but for your health, you are always a patient. That's a clear, vital distinction to make. Okay. Now, before you even get to the diagnosis, there's that vital administrative step that ensures your records are accurate and up to date every single time you visit.
Yes, this is a question you will hear very frequently, almost without fail, at any medical reception desk. It's routine but important.
Right. Let's break this one down. It's a question you'll hear almost every single time you visit a medical office, and it's actually far more crucial for your care than it might seem at first glance. Is your information on file up to date?
This seemingly mundane question is actually absolutely critical, both for patient safety and for administrative efficiency. It ensures continuity of care. Your file refers to that comprehensive document, could be physical. Increasingly, it's electronic, containing all your personal and medical information.
What kind of info?
Things like your current address, your insurance details, your phone number, your next of kin, that's your designated family member, or emergency contact for critical situations.
Okay.
Any past treatments you've received and all the medications you've ever been prescribed. It's a lot.
Yeah.
The phrase on file specifically means that this information is currently present and recorded within your official document or record held by that clinic or hospital.
Right.
And up to date simply means the most recent and the most current, or just plain correct and accurate.
So when would it not be up to date?
Well, for instance, your information would certainly not be up to date if you've moved residences in the last 6 months, or if you've changed jobs and therefore potentially changed your insurance provider.
Good point.
Or even if you've had a new child and need to add them to your family's health records, maybe for insurance purposes. Any significant life change like that really warrants an update.
So if any of those major life changes have happened, it's really imperative you proactively let them know when they ask. It seems like a simple clerical task, but it clearly impacts so much of your care.
Absolutely. The profound insight here is that having up-to-date information isn't just about paperwork. It ensures that in medical emergency, they can contact the right people, or that your medical history is precise for accurate diagnostic and treatment purposes down the line. This meticulous attention to detail is vital for continuity and safety of care.
Okay.
Our source also provides useful pronunciation tips for this phrase. Is your can sometimes sound like is your, or even is urine when spoken quickly and naturally.
Is urine.
Yeah. Information on can link together smoothly. Information on and up to often becomes an unstressed up to. So the whole thing might sound like, is your information on file up to date?
Is your information on file up to date? Got it. Natural flow. Okay, finally. You're in the examination room, the door opens, the doctor steps in. How do they typically start the conversation? How do they invite you to share what's brought you there, but in a polite, professional way?
Yes, this is a classic and very strategic opening line for pretty much any medical professional. It sets the tone.
Right. This next point is quite insightful. It's not just a casual greeting. It's a very specific, polite, and highly effective way for a doctor to invite you to share your story. And it's far better, much more professional than just blurting out, "Why are you here?"
Oh, much better, yeah.
The most common and courteous way a doctor will open the conversation is, "What brings you in today?"
What brings you in today? This phrase is, as you said, a polite and indirect way of asking, why are you here? The latter, while direct, is generally considered too abrupt, potentially even rude in a professional medical setting.
It can sound a bit interrogative, can't it?
Yeah, definitely. What brings you in today skillfully establishes an empathetic, open tone right from the start. It encourages active participation from you, the patient, and sets the stage for a collaborative dialogue rather than a one-sided interrogation. It's really a hallmark of professional bedside manner.
Okay.
And what's truly fascinating here is its remarkable versatility. This expression isn't limited just to medical contexts. You'll hear it from other service providers too.
Oh, yeah. Like who?
Well, a hairstylist might ask, so what brings you in today? And you'd respond, oh, I just want to get a trim.
Right.
Or if you take your car to a mechanic, they might greet you with, okay, what brings you in today? And you'd then explain, well, my engine is making this weird noise.
Okay. So it's a general, polite opener for service situations.
Exactly. Our source also gives useful pronunciation tips here. Brings you often links to sound like brings ya, or sometimes even brings zoo with a slight Z sound.
Brings zoo.
Yeah, just how the sound blend. And you in might have a slight W sound to glide between the words, sounding a bit like you win.
You win. Okay.
So the overall natural flow is often something like, what brings you in today? Or what brings zoo in today?
What brings you in today? Got it. Okay, so once asked, how do you respond? This is where describing your symptoms with real precision becomes absolutely vital, isn't it? This isn't just about saying, I'm sick or I hurt. It's about giving the doctor the specific details they need to actually pinpoint the problem.
Exactly. Your response to what brings you in today is your crucial opportunity to paint that clear, comprehensive picture of what you're experiencing, giving the doctor all the necessary clues to start with.
Right. This next point is so crucial. Truly communicating your symptoms effectively requires way more than just naming them. It's about adding critical details like duration, severity, how things have changed. This is your chance to paint that full, vivid picture for the doctor. Let's look at some real-world scenarios and the precise language you can use, drawing directly from our source material.
Yeah, what's truly insightful here is how using specific adjectives, combining them with precise time frames and descriptions of changes, paints a much clearer picture for the doctor. It moves way beyond just a vague, I hurt. By consciously using this precise vocabulary, you're not just passively reporting, you're actively participating as an empowered partner in your own diagnosis and care.
Okay, let's get specific. What about general pain?
For general suffering or pain, you could simply say, I have a backache. Pretty clear. But to convey a higher level of intensity and urgency, you can use that verb suffer. I'm suffering from severe back pain.
Right, using severe.
Exactly.
Yeah.
And remember, severe implies that high intensity may be an 8, 9, or 10 on that 1 to 10 pain scale. It gives the doctor an immediate grasp of your discomfort level.
Okay, what about a fever?
For a persistent fever, you might say something like, I've had a high fever for 4 days. Notice the grammar. I've had uses the present perfect. That indicates it started in the past and continues right up to now. Vital for chronic symptoms.
Right, duration.
Duration. For 4 days specifies that duration. Whereas since would mark a specific starting point, like since last Friday, you could add more detail. I've been taking Tylenol, but it hasn't gone down.
Ah, okay. Mentioning treatments you've tried.
Yes. It's common for people to try Tylenol, which is acetaminophen, a common OTC fever reducer in North America, before seeing a doctor. So telling them that is incredibly helpful. Also, burning up is a very natural, informal way to say you have a high fever, like your body is radiating heat.
Yeah, you're burning up.
Exactly. And gone down simply means your temperature has decreased. Normal human body temp is around 98 degrees aphid, high 90s. So if it's 104 degrees aphid, the goal is for it to go down towards normal.
That's a fantastic example of how much crucial information you can pack into just 1 or 2 well-structured sentences. Gives the doctor a comprehensive picture super quickly.
It really does.
Yeah.
Another common complaint where precision is key is a chronic cough. You might say, I've had a persistent cough since the beginning of last month and it's getting worse.
Persistent. What does that imply?
Persistent here means it's unstoppable, continuous, it just won't go away. It indicates it's been present for a long period, maybe despite trying home remedies or OTC cough medicine.
Okay.
Again, since marks the specific starting point in time, since the beginning of last month. And the phrase getting worse uses the verb get to effectively show a transition from one state to another, from bad to very bad.
Yeah.
You could, of course, also say getting better if it's improving.
Right. Showing the trend.
Showing the trend, exactly. What about sudden vision changes? You could describe it with this precision. Yesterday, my vision suddenly became blurry in one eye.
Okay.
Vision obviously refers to your ability to see. Blurry means you can't see very well. Objects look unclear, out of focus, like that low-res photo analogy. And suddenly implies an instantaneous change, not gradual. That's an extremely important detail for diagnosis.
Yeah, sudden onset sounds more alarming.
It can be. The source importantly suggests being even more precise here. Instead of just in one eye, specify in my left eye, in my right eye, or maybe in both of my eyes.
Yeah, right. More detail is better.
More detail is better. Pronunciation-wise, blurry in one eye.
Yeah.
You might get that slight ye sound gliding between blurry and in. And one starts with a W sound, affecting how it links. Blurry in one eye.
Blurry in one eye. It's quite remarkable how a seemingly simple detail like suddenly or persistent just gives the doctor so much more to work with, genuinely guiding their diagnostic process.
It truly does. Finally, let's look at skin issues, you might say. There's a strange rash spreading across my arms and chest.
Okay. Rash.
A rash is specifically redness on the skin, often with bumps, irritation, or maybe discoloration. Using strange implies you don't know the origin, or it's unusual for you. Like if you don't normally get rashes from your soap but suddenly have one, it feels strange. And spreading means it's getting worse, expanding its area, moving from one part of your body to another, or just increasing in size.
Okay.
Now, a crucial distinction to remember, highlighted in the source, is between rash and itchy.
Ah, right. Not the same thing.
Not the same thing. A rash is the physical thing. It's what you visibly see on the skin. Itchy is the sensation, the feeling that makes you want to scratch.
Okay.
While rashes often are itchy, the terms aren't synonyms. So you can say, my rash is so itchy, but you wouldn't really say, I have an itchy in the same way you say, I have a rash.
Got it. Rash is the look, itchy is the feel.
Exactly. That precision helps the doctor understand both the visual symptom and your sensory experience. You know, by using this kind of precise vocabulary for all your symptoms, you're not just passively reporting, you're actively participating in your own diagnosis and care. You make the doctor's job much easier, which leads to more effective, targeted treatment for you.
Definitely empowering. Okay, so once you've given the doctor that clear, detailed picture of what's going on, and maybe you've undergone some diagnostic tests to confirm things, the solution often comes in the form of that prescription.
Yes. That's often the definitive next step in charting the treatment journey after the diagnosis is made.
Let's break this down. The doctor has identified a solution, and they'll almost certainly say, I'll write you a prescription. But why do they still use the verb write, even if they're just typing it and sending it electronically straight to your pharmacy?
Yeah, it's a fascinating linguistic legacy, isn't it? It really reflects the evolution of medical practice over time. The doctor's common phrase is indeed, I'll write you a prescription. The verb write is used traditionally because, well, for centuries, doctors physically wrote prescriptions by hand on paper pads.
Right, pen and paper.
Exactly. Even if they now electronically send it directly to a pharmacy, completely bypassing the need for physical writing, write remains the deeply ingrained and common verb. Though you might occasionally hear, I'll give you a prescription.
Okay.
What's truly insightful here is how language often preserves these historical practices, even as technology rapidly changes the actual process.
Interesting.
Grammatically, the future simple tense, all right, is used here because it represents a spontaneous action.
Spontaneous? How so?
The doctor makes this decision and initiates the action right then and there during your consultation. It's in direct response to your symptoms and the diagnosis they just made. They didn't plan it days in advance.
Okay, it's decided in the moment.
Exactly. It's decided in the moment. Zooming out, this linguistic choice kind of underscores the doctor's immediate authority and their decisive action in prescribing your path to recovery. A prescription is, as our source accurately defines it, essentially a written official permission to get a medicine. It serves as the doctor's formal, critical directive for your treatment.
So it really signifies that critical moment of decision and immediate action on the doctor's part, even if the method of delivery pen versus computer has totally changed.
Precisely, yeah. It's the formal commencement of your specific treatment plan, initiated right then.
Okay. So what does all of this mean for you, our listener? We've truly taken an extensive deep dive today, haven't we, into the often complex but ultimately crucial language of healthcare.
We really have covered a lot of ground.
Yeah, we've meticulously unpacked everything from the nuanced definition of what it truly means to be an inpatient versus an outpatient to the subtle but vital distinctions in how we precisely describe our symptoms, whether it's a persistent cough or blurry vision or severe pain.
Right. Those details matter.
They really do. We even covered the specific language you'll encounter right at the front desk, like why you distinctly have an appointment and definitely never a meeting in a medical context.
Yeah, that's a key one.
Our overriding goal throughout this whole deep dive has been to provide you, our listener, with a definitive shortcut, a way to become profoundly well-informed and genuinely confident in medical settings. We want to transform those moments of maybe jargon-induced anxiety into clear opportunities for empowering and effective communication.
And the broader implication here, I think, is profound. Mastering this specific medical vocabulary isn't just about, accumulating words. It's fundamentally about empowerment.
Yeah.
It's about equipping you to clearly and accurately articulate your needs, to fully comprehend diagnoses when you receive them, and to effectively participate as an active partner in your own care.
An active partner. I like that.
Exactly. And this fosters a more transparent, more trusting, and ultimately a more effective relationship with your healthcare providers. This knowledge empowers you not only to ask the right, maybe more incisive questions, but also to truly understand the answers you get back. It allows you to feel genuinely more in control of your own health journey, which naturally leads us to ask this final question for you to think about. Now that you're armed with this precise medical vocabulary, how might actively and consciously using these terms not only significantly benefit your own health outcomes,
right,
but also fundamentally transform the very nature of that patient-doctor communication into a more collaborative and truly deeply informed partnership? Just think about how much more impactful, how much more effective your next conversation with a medical professional could actually be.
That's a powerful thought to end on. Thank you for joining us on this enlightening deep dive today. We sincerely hope you feel not just more confident, but truly empowered and well-informed, ready for whatever your health journey brings your way next.
Okay, let's unpack this health, right? It's not just, doctors and hospitals. It's pretty much the constant background noise of our lives, isn't it?
Absolutely.
From those quick chats like, how are you feeling with friends, to much deeper, maybe more significant discussions about family or, serious talks with actual medical professionals.
It's deeply personal, yeah, but also totally universal. Everyone deals with it.
And what I find really fascinating is how we talk about it. The words, the phrases we pick, they can totally shape how we understand things, maybe even what we do about them.
Precisely. And we often throw around these health terms, these idioms, without fully getting the nuances, maybe, or the specific context that makes them tick.
Right. Like you get the general idea, but maybe miss the finer points.
Yeah.
Or the difference between two phrases that sound kind of similar.
Exactly. So our mission today in this deep dive is basically to pull out those really crucial nuggets of knowledge from your sources on, let's say, advanced health vocabulary. We want to equip you, the listener, with really precise language for talking about both physical and mental well-being. Think of it as like a shortcut to being genuinely well-informed.
Yeah, so you can talk about your own stuff more clearly, understand what others are going through, and just navigate all the health info out there with more clarity.
Absolutely.
Yeah.
This isn't just, learning vocab lists. It's about unlocking a better way to talk about one of the most important things in life. We're doing a real deep dive here into the actual language of health.
Yeah.
We'll cover those everyday idioms, the colorful ones about emotions, then hit some crucial medical acronyms that are just part of daily life now.
Right.
And even dig into some specific terms for mental states, emotional experiences, and the physical side too.
There should be some real aha moments, I think. Definitely. And practical stuff, too. We'll show how knowing this language can actually empower you in ways you might not expect. Okay, so let's kick off with idioms. They're kind of the poetry of health language, right? Packing so much meaning into just a few words.
Especially for our inner world, our emotions.
Yeah, exactly.
Yeah.
So first one, to bottle something up. We all kind of know this one, right? Suppressing emotions, hiding them away inside.
Yeah, locking them down.
Like putting a really tight lid on a boiling pot, just hoping it doesn't explode everywhere.
And what's genuinely insightful there, I think, is how that idiom points to this deep internal conflict. Bottling up isn't just forgetting feelings. It's this active, often really exhausting effort to contain powerful stuff, anger, sadness, fear, whatever it is.
Right. And why do people do it? To avoid conflict, look strong, protect others.
All of the above sometimes. Or maybe they just haven't learned healthier ways to cope. Your sources had those great examples like, if you keep bottling up your anger, it might eventually explode at the wrong time.
Which isn't just a metaphor, is it?
Not at all. It speaks to the real physiological and psychological toll. Studies show that constantly bottling things up can actually increase stress hormones, raise blood pressure,
Right.
even mess with your immune system. It can show up as tension headaches, stomach problems, or just this vague feeling of unease.
So that advice, it's healthier to talk about your problems than to bottle them up. It's not just fluff.
No, it's fundamental. It points to the need for healthy emotional processing. Releasing that pressure valve before the whole system breaks down. It's key for long-term mental and physical health.
That link to physical consequences is so powerful. It's not abstract. It has real impact. Okay, staying with emotional control. 2 idioms that sound super similar but are actually pretty different. To pull yourself together versus to get your act together.
Ah, yes, a classic point of confusion.
So pull yourself together. This is really about regaining control of your emotions, right? Especially when things are going pear-shaped, someone's upset, crying, panicking, and you say, hey, pull yourself together. You're asking them to compose themselves. Find that emotional balance again.
And it nearly always uses that reflexive pronoun, myself, himself, yourself.
Exactly. Pull yourself together. Your sources even had that funny picture, right? The cool cat telling the frantic cat to pull yourself together.
Haha, yeah. It perfectly captures that idea of urging internal composure, like telling your own nerves to straighten up.
So it's internal. What about the other?
Okay, so the distinction here is absolutely crucial. Pull yourself together is profoundly about internal emotional regulation, finding that inner calm when feelings are overwhelming. It's personal, immediate self-control in distress, not ignoring the feeling, but managing how it comes out so you can function.
Okay.
To get your act together, though, that's about external organization, efficiency, getting your life sorted.
So practical stuff.
Exactly. If someone's always late, missing deadlines, their place is a mess. You might say they need to get their act together. It's about becoming more competent, less chaotic in your actions.
So one's internal feeling management, the other's external life management.
Precisely. And while they can be linked, like being emotionally distressed makes it hard to get your act together, they're fundamentally different processes, managing feelings versus managing tasks.
That makes so much sense. And sometimes you feel overwhelmed by both, right? Which brings us nicely to 2 more similar sounding phrases. To have a lot on your mind versus to have a lot on your plate.
Another pair that gets mixed up.
So a lot on your mind. That's when you're mentally preoccupied, right? Worried, constantly thinking about something.
Yeah, your brain's just buzzing.
Could be money worries, family stuff, a big decision. It often leads to feeling overloaded mentally. Forgetful, maybe. Can't concentrate.
Exactly. Your sources nailed it with examples like, I've had a lot on my mind lately with work deadlines and family issues.
Or he couldn't focus because he had a lot on his mind. It's that internal processing, the mental chatter.
And the nature of that burden is key. A lot on your mind usually implies this emotional or cognitive weight that's hard to just, put down. It's worries, thinking things over and over, that continuous mental effort. It can mess with your sleep, cause anxiety, that kind of thing.
Okay, so how's a lot on your plate different?
A lot on your plate means you're just incredibly busy.
Yeah.
Many different tasks, projects, responsibilities filling up your schedule.
So workload.
Yes, primarily workload. A hefty to-do list, lots of active duties. Now, this can sometimes lead to forgetfulness just because you're juggling so much.
Sure.
But the core meaning is about busyness and practical responsibilities, not necessarily internal worry. You could have a lot on your plate and be totally fine with it, just very occupied.
Okay. So the distinction helps people know how to respond.
Exactly. If you say a lot on my mind, someone might ask, what's worrying you? Offering emotional support.
Right.
If you say a lot on my plate, they might ask, can I help with anything? Offering practical help. Precise language leads to better support.
That is such a great point. Tiny language differences, big impact. And sometimes having all that stuff on your mind or on your plate can lead to our next idiom. To have a short fuse.
Or short temper. Yeah, they mean the same thing.
It just means you get angry easily, right? Lose your temper quickly, maybe over small things.
That sudden snap, yeah. Disproportionate anger.
The phrase itself, short fuse, is so visual, like a bomb about to go off quickly.
It really is. And your sources had that great comic analogy, remember? The 2 bomb characters, one with a tiny fuse.
Yeah, ready to explode any second.
And what's important here, I think, is that while we talk about it like a personality trait, Often it's actually a result of other stuff.
Like you were saying, stress, being overwhelmed.
Exactly. Persistent stress, not enough sleep, chronic pain, just feeling swamped by having a lot on your mind or on your plate, all that can seriously shorten your fuse.
Makes sense. Your coping resources are just depleted.
Precisely. Chronic stress keeps your nervous system on high alert, making you more reactive. So someone normally calm might get snappy just because they're run down.
So it's more empathetic to see it as a symptom sometimes, not just a flaw.
I think so. It encourages looking for the root cause.
Yeah.
And yeah, we usually use it with have, like he has a short fuse when he's tired.
Okay, let's switch gears a bit. Moving from emotions to our physical state. Let's talk about being fit as a fiddle.
Lovely one.
It really is. Such a nice way to say someone's in excellent health, super physically fit, vibrant, strong.
It implies more than just not sick. It's got this energy to it.
Totally. And it's not just for, your surprisingly spry grandpa. You can use it for anyone in great shape, like that marathon runner example. Wow, you must be fit as a fiddle.
Or someone who juggles a busy life but stays healthy. She stays fit as a fiddle with daily workouts.
And grammatically, it's a simile, right? Using as, not like, fixed phrase.
Right. And the choice of fiddle is interesting, isn't it? It's not just about strength, but like a finely tuned instrument.
Oh, I like that.
It suggests holistic health, optimal performance. A fiddle in good hands is responsive, precise, working perfectly.
So the idiom implies being perfectly balanced, working at your peak. That's quite sophisticated for such a simple phrase.
I think so. Its long history shows how well it captures that idea of peak condition vitality, smooth function, not just muscle.
Okay, so from peak condition to regaining it. Our next one, back on your feet, is great for describing recovery.
Recovery from tough times.
Yeah, usually recovering from an illness or injury, like you've had the flu, stuck in bed, then you're finally up and about again.
You're back on your feet.
Exactly.
Yeah.
And we often say, in no time, right?
Yeah.
Suggesting a quick recovery, you'll be back on your feet in no time.
And what's really useful about this one is how it stretches beyond just physical illness. It captures regaining stability, getting back to normal after any kind of setback.
So not just sickness.
No. It works beautifully for emotional recovery or even financial trouble. Your sources had those two perfect examples.
Oh yeah, the podiatry one.
Right, the podiatry team ad, getting you back on your feet. Clever pun, literal and figurative recovery. And then the more serious one, steps to get back on your feet financially after identity fraud.
Wow. Okay, so it really covers returning to stability after any major knock.
Exactly. It speaks to that universal human drive to overcome hardship and regain control.
That's really useful. But sometimes, before you get back on your feet, you might be feeling run down.
Yes. That feeling of deep exhaustion.
It's more than just tired, isn't it? It means feeling totally wiped out, depleted, exhausted, drained, worn out.
Your energy reserves are just gone. Body and mind screaming for a rest.
And it often implies you're so drained your defenses are down, right? Like that example. He was so run down from stress that he caught a cold.
Precisely. It suggests a cumulative effect of prolonged strain, maybe lots of travel, chronic stress, intense work.
Like the end of the semester feeling.
Exactly. I always feel run down at the end of the semester. It captures that collective mental and emotional depletion perfectly.
So recognizing you're truly run down, not just tired, is important for self-care.
Absolutely. It's a signal you need genuine rest before something more serious happens. Preventative awareness.
Got it. And sometimes being run down or facing illness might lead to, needing surgery. Which brings us to our last idiom here. To go under the knife.
A very direct, quite informal one.
Yeah, it creates a real image, doesn't it? Literally under the surgeon's knife.
And while it means exactly the same as undergo surgery or have an operation, that informality is key. It raises that point about tone in health talks. Surgery is serious, often life-changing.
So people might prefer more formal words.
Often, yes. Especially in clinical settings or talking about something major, undergo surgery conveys the gravity better.
But maybe with close friends.
Exactly. In casual chats, going under the knife might be used to quickly say what's happening, maybe even with a bit of dark humor as a coping thing.
Like that Halloween comic example.
Yeah.
The jack-o'-lantern.
Yes, the carved pumpkin saying, "I went under the knife, do you like it?" It's morbidly funny, but perfectly shows how the phrase indicates surgery, even lightly.
Okay, let's shift again. From idioms to a different kind of shortcut. Acronyms.
The alphabet soup of health talk.
Totally. Our health conversations are packed with them. Medical reports, news, just casual chats, they're everywhere. And knowing what they mean is like having a superpower, really. It's basic health literacy now, even if you're not in the field, a real shortcut to understanding.
Absolutely true. They simplify these complex conditions or procedures into easy-to-say units. They allow quicker communication, like in busy hospitals, but you have to know the meaning behind the letters to avoid confusion.
Right. So first one, you definitely heard this, ADHD. Stands for Attention Deficit Hyperactivity Disorder. It's a complex neurological thing, characterized by ongoing patterns of inattentiveness, hyperactivity, impulsivity.
And it's a spectrum, right?
Exactly. That's crucial. It ranges from pretty mild, maybe just some focus issues or restlessness, to really severe cases that seriously impact daily life, learning, relationships.
Yeah.
And what's striking is how everyone just says ADHD. You almost never hear the full name.
It's completely taken over.
Yeah, and I bet most people listening know someone with ADHD. It's so common.
Yeah.
Your sources had those funny, relatable examples.
Oh, yeah, the joke.
ADHD, your secrets are safe with me because I probably wasn't listening.
Captures the inattentiveness.
And the other one, look, I have ADHD, so you need to be way more interesting.
Right. They're lighthearted, but they subtly point to the real challenges with focus and engagement.
But it's important to remember it's not just a joke. Right?
Absolutely. Behind the relatable humor is a genuine neurological condition with real daily hurdles, executive function, emotional regulation, getting things done. It's not a character flaw. The brain's just wired differently.
Yeah.
And that raises the question, how do we balance that casual use with the clinical reality?
Yeah, because misconceptions are common. Like it's only kids or it's just bad discipline.
Exactly. Understanding the real definition helps build empathy and allows for more accurate conversations.
A really crucial point.
Okay.
Okay, next up, PTSD, post-traumatic stress disorder, a serious condition caused by experiencing or witnessing something truly traumatic. We often hear about it with veterans, soldiers who've seen combat.
And sadly, many do struggle with it.
Yeah, needing long-term support.
And this is vital. While it's often linked to military service, PTSD can result from any traumatic event. Absolutely any.
Not just war.
Not at all. Natural disasters, earthquakes, floods, serious accidents, assault, domestic violence, a major loss, even just witnessing something horrific.
Okay.
The key is that the event felt life-threatening or deeply disturbing, leaving that lasting psychological mark. Understanding that broad range is crucial for empathy and making sure everyone who suffers gets recognized and supported.
That makes sense. It avoids making some trauma seem less valid than others.
Precisely. It recognizes the universal impact of trauma.
Okay. Moving into diagnostics. MRI.
Magnetic resonance imaging.
Right, that high-tech imaging thing that shows detailed pictures of inside your body organs, soft tissues.
Incredible detail.
Used for everything,
Yeah.
right? Brain scans, knee injuries, finding tumors, checking spines. And like ADHD, everyone just says MRI. You never hear the full name.
Never.
And that quick grammar tip,
Yeah.
it's an MRI because it starts with that M sound.
Good point. A common slip-up.
It's just such a standard part of healthcare now.
And what's revolutionary about it, maybe not widely known, is it gets that amazing soft tissue detail without using ionizing radiation, unlike X-rays or CT scans.
Oh, right. That's a huge advantage.
Huge. It totally changed how doctors diagnose and track neurological issues, soft tissue injuries, certain cancers. It gave this non-invasive window into the body that just wasn't possible before.
Wow. So its commonness reflects its power.
Definitely. It made complex internal problems visible and understandable through just 3 letters.
Okay, next, ICU, intensive care unit.
A very serious place.
Yeah. A specialized hospital unit for critically ill patients, life-threatening conditions needing constant treatment and monitoring.
Round-the-clock care, highest level, often complex machines helping people breathe, tracking vital signs.
Right. And here, you hear both, don't you? ICU and the full intensive care unit, or just intensive care.
Yeah, both are common, but saying someone's in the ICU immediately tells you it's serious. The gravity is understood.
It's where advanced life support happens.
Exactly. Ventilators, complex monitoring, specialized drugs to keep organs going. The staff-to-patient ratio is much higher, too, because they need constant watching and quick action.
But it's also a place focused on healing. Right. Getting people stable enough to move out.
Absolutely. It signifies critical illness, yes, but also intensive recovery efforts, aiming to stabilize and move patients forward.
Then there's ENT. Simple one.
Ear, nose, and throat doctor.
Makes sense why they're grouped, right? Problems in one often affect the others.
Totally interconnected. Sinus infections hit the ears, allergies affect the nose and throat.
So if you've got chronic tonsillitis, Ear infections that won't quit, sleep apnea, bad sinus problems, you see an ENT.
Right, or a otolaryngologist, if you want the fancy name. They handle a huge range, removing tonsils, fixing hearing, balance issues, even head and neck cancers.
Wow, quite a range. Deals with key senses and functions.
Yeah, hearing, smell, taste, breathing, swallowing. Big impact on quality of life.
Okay, last acronym for this section. OCD, Obsessive Compulsive Disorder.
A complex one.
Yeah, it involves two main things. Obsessions, those unwanted, intrusive thoughts or urges.
Like a persistent fear of germs.
Exactly. And compulsions, the repetitive behaviors someone feels driven to do because of the obsessions.
Like the excessive hand washing in response to that germ fear.
Right, even if it hurts them.
And this brings up that crucial point again about casual language versus clinical reality.
Yeah. People use OCD very loosely, don't they?
Regrettably, yes. Someone might say, oh, I'm so OCD about tidiness, or he's a bit OCD about lining things up.
Just meaning neat or particular.
Exactly. But that casual use really doesn't capture the reality of the diagnosed disorder, which can be incredibly distressing, time-consuming, and debilitating.
It kind of trivializes the actual suffering.
It can, unfortunately. So it's vital to remember the distinction. The informal use for quirky habits is miles away from the clinical diagnosis.
Like that gas station comic example, agonizing over stopping at 10 gallons or $40.
Right. It humorously shows obsessive tendencies, but it's a stark reminder of how different that is from the real disorder. Understanding the formal definition is key for respect.
So, thinking about all this, what does it mean for understanding health overall? We've covered idioms, acronyms, but let's zoom in now specifically on mental health terms.
Good idea. It's an area where language is evolving so fast and thankfully getting more public attention.
Yeah, more nuanced, more inclusive terms are popping up.
Exactly. As our scientific grasp of the mind grows, the words we use to describe its variations and challenges have to keep pace. Better terms mean more precise, more empathetic conversations.
Definitely moves us past old, maybe stigmatizing language. Okay, first one. Neurodivergent.
A really important one.
It describes people whose brains developed or function differently from what's considered typical or neurotypical.
It's an umbrella term, right, covering autism, ADHD, dyslexia, Tourette's.
Yeah. And the key idea is seeing these differences not as deficits to be fixed, but as natural variations in how human brains work.
A real paradigm shift.
Totally. It's becoming much more common in talks about brain differences, pushing for more inclusivity. That Rain Man example from your source.
Dustin Hoffman's character. Iconic.
Yeah, a powerful portrayal of autism. He'd absolutely be described as neurodivergent today. His amazing abilities in some areas alongside challenges in others really shows the concept.
And what's profound about neurodivergent is how it reframes things. It moves away from seeing differences as flaws or disabilities towards seeing them as valid, even valuable forms of human diversity. Different cognitive styles, different strengths.
So not one right way for a brain to work.
Exactly. It's about reducing stigma, promoting acceptance. Recognizing a neurodivergent brain is just organized differently.
That's a huge shift.
Okay.
Next, a more specific, maybe more advanced term. Psychosomatic.
The mind-body connection in action.
Right. It describes physical symptoms, real physical symptoms, that are actually caused or made worse by mental factors. Stress, anxiety, emotional distress.
So the mind literally affects the body's feelings.
Yeah. Like that example, her headaches were determined to be psychosomatic. The pain was real, but the root cause was mental tension.
Happens with stomach issues too, like IBS or skin conditions like eczema, even chronic pain sometimes, all worsened by mental state.
It really challenges that old idea of mind and body being totally separate, doesn't it?
Completely. It shows emotional distress isn't just in your head, it has measurable physical effects. It's crucial for holistic health needing to treat the mind when dealing with the body and vice versa.
Explains why relaxation might help physical pain.
Precisely. Or why stress weakens the immune system. It forces us to see health as this complex, integrated system. Symptoms can have layers of causes.
Super important concept. Okay, next. Comorbidity. This sounds quite clinical.
It is, generally. You'll hear it more in medical settings or read it in health reports.
And it means having two or more distinct medical conditions at the same time in the same person.
Exactly. Like the example, obesity is often a comorbidity in patients with type 2 diabetes. They frequently occur together.
Okay. Or maybe depression and anxiety together.
Very common comorbidity. Or heart disease and sleep apnea.
And it's not just that they happen together, but they interact.
Often, yes. One condition might affect the onset or severity of the other. It makes treatment tricky, needing a coordinated plan that looks at the whole patient.
Not just isolated symptoms.
Right. It's fundamental to modern medicine, acknowledging how complex and intertwined health conditions can be, especially with chronic diseases becoming more common.
Makes sense. Okay, shifting to something more positive about mental strength. Resilience.
The ability to bounce back.
Yeah, that amazing human capacity to recover from setbacks, tough times, trauma. We talk about it a lot in mental health, bouncing back from grief or stress. But it's used much more broadly too, right? Like overcoming career fails, money troubles, any disappointment.
Absolutely. It's a general term for toughness and recovery.
And it's not just something you're born with. You can build it.
Definitely. Through therapy, learning coping skills, having good support systems, even things like mindfulness practice can build resilience.
And you can use it as a noun, her resilience, or adjective, he's resilient.
And fundamentally, it's about our ability to adapt, recover, maybe even grow from adversity. It's not about avoiding pain, but about navigating it well.
Exactly. And emerging stronger. It's not being immune to stress. It's how you respond and recover. It combines inner resources like self-awareness and outer ones like support.
Which raises bigger questions, doesn't it? How can we foster more resilience individually and collectively? A profound question, especially now. It's key for individual well-being and society's health-facing challenges.
Truly powerful idea. Now, what about when resilience is maybe overwhelmed? Let's talk emotional burnout and emotional breakdown.
Okay, important distinctions here too.
So emotional burnout, that's feeling totally mentally and emotionally drained, usually from long-term stress, like in demanding jobs or caring roles.
Yes, it's that gradual wearing down of energy, leaves to feeling cynical, detached, like you're achieving less, running on empty, basically.
Like that Kermit the Frog picture, looking exhausted, slumped over.
Yeah. Symbolizing that feeling of constant overwhelm, endless tasks. It's not easy being green, indeed. That's burnout.
So it's gradual. How's emotional breakdown different?
Breakdown suggests something more abrupt, more acute, a crisis point where your coping mechanisms just collapse.
Like an inability to function.
Temporarily, yes. It's a more severe, often sudden sign of extreme psychological distress. Might need immediate help.
So burnout is the slow burn, breakdown is the sudden collapse.
Generally, yes. It highlights the spectrum of exhaustion. And it underlines why catching burnout early, setting boundaries, getting support is so vital. Preventative mental health care.
So important. Okay, last one for this section. Grounding techniques.
Practical tools for staying present.
Yeah. These are methods to help you stay in the moment, reduce anxiety. Especially useful for panic attacks, flashbacks, trauma stuff, dissociation.
When you feel disconnected or overwhelmed.
Right. They're often simple things you can do anywhere, anytime, to anchor yourself back to reality.
And they really showcase the power of conscious action in managing our mental state. They give you immediate, accessible tools for self-regulation.
How do they work?
Right.
Engaging the senses.
Exactly. Redirecting focus away from distressing thoughts towards the here and now, like focusing on your breath, feeling your feet on the floor.
Or that 5, 4, 3, 2, 1 thing.
Right. Name 5 things you see, 4 you hear, 3 you feel, 2 you smell, 1 you taste. Or just holding a specific object. They empower you with ways to self-soothe, create safety when things feel chaotic.
Which makes you wonder, how can we use these more proactively, not just in crisis?
An excellent question. Integrating simple grounding practices into daily life could be a powerful support for general mental well-being. Okay, so building on that mind-body connection, let's pivot now specifically to the language of physical health. Equally crucial, full of precise terms we encounter all the time. Exercise, symptoms, conditions, prevention.
Absolutely. First up, cardiovascular. And it's everyday buddy, cardio. So cardiovascular, that's the adjective for the whole heart and blood vessel system, right? Your circulation.
Whole network.
But in daily life, everyone just says cardio, and usually means cardiovascular exercise, running, swimming, cycling, anything that gets the heart pumping.
Yeah, the aerobic stuff.
And the benefit's super clear. Regular cardio improves heart health, makes the heart stronger, boosts stamina. You'd say, I need to do more cardio.
And it's interesting how cardio has almost become a noun or verb itself. Go do some cardio, hit the cardio machines.
Yeah, it's totally ingrained in how we talk about exercise.
Shows how much public awareness there is about heart health and the specific activity needed. It's part of that proactive health talk, not just losing weight, but optimizing a vital system.
Definitely. Okay, next word, chronic. An adjective meaning something lasts a long time, right? Persists.
Typically 3 months or more, often manageable, but not easily cured.
And we hear it with things like chronic back pain, long-lasting pain, chronic stress, ongoing pressure, and chronic inflammation.
When something's chronic, it's not a quick passing thing. It's long-term, needing ongoing management.
And that chronic inflammation one is particularly important.
Very. It's when the body's immune response, which is normally helpful short-term, stays switched on.
So instead of healing and stopping, it just keeps going.
Exactly. A persistent, low-grade, harmful response causes ongoing redness, swelling, pain internally. And the real danger is that over time, this can silently damage tissues and organs,
leading to serious diseases.
Yes. It's linked to heart disease, diabetes, some cancers, autoimmune conditions. So chronic signals long-lasting, persistent, and potentially serious long-term impact.
That distinction between acute, sudden, short-term, and chronic long-lasting is really key then.
Crucial. Acute things might be dramatic, but chronic conditions, while maybe less dramatic initially, can have a huge pervasive impact on long-term health and life quality. Understanding chronic helps us talk about disease management, sustained care, lifestyle factors. It highlights the need for endurance, both from the condition and the patient.
Really important distinction. Okay, from chronic issues to a much nicer phrase, in good shape.
Ah, yes, very common.
It means physically fit, healthy, generally in good condition. Sounds more natural than just physically fit, maybe. Less clinical.
Definitely more conversational. He's in good shape for his age.
But here's the cool part. It's flexibility. Your sources showed it's not just for people.
Right. You can describe things as being in good shape.
Like, the economy is in good shape, meaning it's healthy. Or, signs your heart may not be in good shape, talking of the organs function.
It's wonderfully versatile.
And isn't it fascinating how a phrase about physical health has spread metaphorically to describe optimal condition in abstract things?
It really is. It shows how we value things. Bodies, finances, machines being well-ordered, functioning optimally.
Healthy operation. Everything working as it should.
Exactly. It makes you wonder how our core understanding of physical health shapes how we perceive health in totally different areas. A deep appreciation for things working right.
Great point. Okay, speaking of things working right, how about boost your immune system?
Supporting your body's defenses.
So the immune system is that whole complex network defending us against illness. And the phrase we usually hear is to boost your immune system, right? Not really raise or strengthen.
Boost is definitely the common collocation. Implies giving it an extra push, enhancing effectiveness.
And things like good sleep are key for boosting it.
Absolutely crucial. Good nutrition, managing stress too. It's about enhancing the body's natural ability to fight things off.
And that word boost suggests a proactive approach, doesn't it? Not just waiting till you're sick.
Exactly. Fits with that whole wellness trend, preventative care, taking personal responsibility.
But it also makes you think, what actually works to boost it? Beyond sleep, how do we sort through all the health fads?
Excellent question. We need to focus on evidence-based stuff. Regular moderate exercise, balanced diet with lots of fruit and veg, gut health, reducing chronic stress. Those are scientifically backed ways to support or boost the immune system. Actionable self-care.
Good practical advice.
Okay,
finally, for physical health terms.
Yeah.
Sedentary lifestyle.
A major modern issue.
Describes living with very little physical activity, right? Lots of sitting, lying down.
Yeah. Desk jobs, remote work, easy entertainment. It's a big challenge now.
And unfortunately, it has really negative health impacts, big risks.
Huge risks. Increased risk of heart disease, type 2 diabetes, obesity, some cancers, even affects mental health.
Your sources had that funny visual, the recumbent cat.
Yes. Playing on recumbent, meaning lying down. The cat just draped over the couch.
Perfectly captures that minimal effort vibe.
It's amusing, but a sharp reminder that while lounging is nice, being consistently sedentary is genuinely harmful. Our bodies need to move.
And it's become such a key term in health discussions now, hasn't it?
Yeah.
Reflecting this big societal shift.
Absolutely. It highlights a major public health concern driven by modern life reducing physical effort.
Which raises the question, how do we fight that push towards being sedentary, individually and as a society?
Exactly. It's a call to reevaluate daily habits, find ways to build in more movement, even small bits, micro breaks, standing more, countering that default inertia. Hashtag tag tag outro.
Okay, so here's where it all kind of clicks together, doesn't it? We've covered so much ground today, digging into the real meaning behind all these health words and phrases.
A real journey through the language.
Yeah, from those emotional idioms like bottling things up, distinguishing pull yourself together from get your act together, nailing acronyms like MRI and PTSD,
to understanding bigger concepts like neurodivergent and resilience and chronic versus acute.
Exactly. We've seriously beefed up our vocabulary for both mental and physical health. This deep dive has given us, and hopefully you listening, a really solid understanding. Those key nuggets, distilled and ready to use.
Precisely. And more broadly, this isn't just about words, it's really about empowerment, I think.
How so?
Well, health is just so central to our lives, isn't it? Talking about ourselves, supporting others, understanding news.
Sure.
The more precisely you can understand and use these terms, the clearer your communication becomes. You can express yourself better, advocate for yourself or others, understand information more deeply.
So you encourage people to actually use these words.
Absolutely. Listen for them. Notice how others use them. Then find authentic ways to weave them into your own conversations, your writing. Make them part of your toolkit.
Right. So as you navigate your own health journey or talk with doctors or just chat about well-being, here's something to think about. How might having this richer, more precise vocabulary actually empower you to understand, express, and advocate for what truly matters in this really complex, always changing world of health?
A great question to ponder.
Definitely something to mull over. We'll be back with another deep dive soon.